Hello and thank you for tuning in. In this video, I'm going to talk about anesthesia for heart surgery or cardiac anesthesia. This includes anesthesia for blocked heart arteries, dysfunctional heart valves, heart transplants, aortic aneurysms, and dissections. The thought of heart surgery can be very intimidating, stressful, and anxiety-provoking. Know that your care team is experienced and has cared for patients like you time and time again with success. Your cardiac anesthesiologist plays a critical role. On the day of surgery, we review your history, perform a physical exam, describe what you should expect, and most importantly, get your permission to proceed with the surgery. When we are ready with an IV, we take you to the operating room. And in the operating room, we apply several monitors that will help us get you through surgery as safely as possible. This includes an arterial line that we place while you are still conscious, which is used to analyze your blood and measure your blood pressure as the heart relaxes and squeezes beat to beat. We then give you oxygen and get you under general anesthesia with the medications we give you through your IV. Once under, we place a breathing tube, transesophageal echo probe, and a central venous line. While the breathing tube breathes and oxygenates your blood, the echo probe allows us to see the heart in real time, and the central venous line, usually placed in the vein of the neck, allows us to give medications directly into the heart. Additional monitors include a catheter that drains urine from your bladder, and brain function monitors that tell us how well oxygen is getting to the brain and how relaxed it is. We use a heart and lung machine during a critical part of the surgery, and it is run by perfusionists who are trained to run it. When it is used, the machine oxygenates and pumps blood for your body when the heart and lungs are not moving. And though a complicated machine, it essentially drains blood from the body through one line, oxygenates the blood, and returns it to the body through another line continuously. The heart and lungs are not moving during this time so that the surgeon can carefully operate. Once he or she is done performing that part of the surgery, getting the heart and lung going again is performed safely with communication between the surgeon, anesthesiologist, and perfusionist. Through the central line, we give fluids, correct electrolytes, and give medications to stimulate the heart and lungs back up, and assess the heart function with echocardiography. At the end of the surgery, the echo probe is removed, while the breathing tube, arterial line, and central line are kept in. We then transport you to the surgical intensive care unit where you will be monitored closely by a specialized cardiac care team. As the anesthesia wears off, you begin to emerge and take over your own breathing. And then that breathing tube is removed. Thank you for your attention. I hope this video was informative. Please leave a comment or question and share it where you find it appropriate.